Hi, my name's Dr. Dave Spainhauer, and I'm a TMJ dentist. And I'm hoping from this video, many of you will find the solution to your TMJ pains today. Because I'm a lot like you, I know what it's like to feel the pain and frustration and embarrassment of suffering through symptoms of TMJ. For much of my teenage and early adult life, I didn't know what to do about my TMJ problems, and I really didn't think there was anything that I could do about it. It felt like it was something I was just going to have to live with. But the thoughts of spending the rest of my life trying to cope with these symptoms was pretty frustrating. Fortunately, I found that there are solutions to TMJ pain, and I was able to get my life back and feel like a normal young man again. So keep watching this video, as I'm hopeful that many of you will find the solution for your own TMJ pain during this video. And I'll share 2 secrets that are most often misunderstood by both consumers and many dental professionals. From as far back as my teenage years, since I was about 15 years old, I suffered from TMJ symptoms and pains. And this is where I was with my TMJ problems. My jaw joints popped so loud when I ate that the popping could be heard from people from across the room. I would dread going to the dentist because most often when the dentist would lower me down in the dental chair, my jaw would lock up. So when the dentist would say, "Open wide," I had to pause and move my jaw around. I'd sit up, move it around, and get it unlocked, and lay back down, and then the dentist could start working. And I felt embarrassed about that when I couldn't open my mouth. My dentist never really offered any solutions to fix my TMJ problem. So going to the dentist just became one more source of embarrassment and frustration. Several years later, while attending college at Weber State playing football, the pain and frustration with my TMJ problem reached a whole new level. As a defensive back playing football, there were times when I would make a tackle and my jaw would lock up during the tackle. Now, as you might imagine, with the pounding and rough play with 2, 3, 4, 5, 6 football players rolling and falling to the ground, and when my jaw locked up at the same time during that play and then getting jostled around was extremely painful. It was frustrating, and it limited my concentration and affected my play. In addition to those challenges, I found that I couldn't chew gum for more than 5 to 10 minutes at a time because my jaw would start to lock up. I remember thinking, what's wrong with me? Why me? I'm not normal. I just wanted to be a normal young man like my friends. And eat normal foods, eat the foods I wanted to eat without experiencing the embarrassing popping sounds and pains. So that's what I aspired to be like my friends and the other young men my age. It took enjoyment out of being with my friends, and especially as I began to date. Later in dental school, I finally learned what was happening with my jaw and what the source of the pain and frustration was. And that was the beginning of my focus and passion for treating TMJ. I would meet my instructors between classes, at lunch, and after school to try to absorb all the information and experience I could from them. Not everyone will be cured like I was, but this is how I discovered the answer for me. I'll never forget the first time I wore a custom TMJ splint and how it made my jaw feel secure and comfortable. It finally relieved my pains and discomforts for the first time. It showed me that there is a solution for my situation for the pain that I've been suffering from for so long. It was overwhelming to finally know that there was something that would work in my case to help me get my life back, just to feel normal again. I now felt that I had some knowledge to help others reduce their pain so they don't have to go through the same or similar frustrations that I was going through. In dental school, it was an easy fit, and I naturally focused on treating TMJ problems because I could relate to the pain and difficulties of having TMJ problems. So I made it a priority to seek out advice and knowledge from my professors when I could. Shortly after graduating from dental school, I opened up a private TMJ practice starting just one night a week to focus on treating TMJ patients. I had a thirst for knowledge and immersed myself with everything I could get my hands on that was written by the experts at the time. I literally thought about treating TMJ basically every minute of the day. I'm kind of embarrassed about this, but my first year out of dental school, treating TMJ filled my thoughts so much that I couldn't even go to a movie and enjoy it. As treating TMJ filled my thoughts so much, I couldn't pay attention to the movies. And even worse, I would go to church and I couldn't pay attention to what we were being taught. I tried and tried to get TMJ, treatment of TMJ out of my mind, but I just couldn't. I'm not proud of it, and I'm embarrassed, but it's the truth. It was interesting to see that most clinicians at the time believed that TMJ pain was primarily caused by having a bad bite. Therefore, the primary course of treatment was to correct the bad bite by a combination of including shaving teeth down, doing fillings, doing braces or orthodontics, putting one or more crowns on, up to even crowning every single tooth in the mouth to reposition the jaw to correct the bite. Over the next couple of years, I began to see common patterns between my TMJ patients and my patients that had tension headaches. Through time, I noticed the correlation of habits of those with my TMJ pain patients, that they were the same as those with the headache patients. I began to be more accepting to alternative treatments for TMJ patients. So, besides the night guards, I started recommending physical therapy, chiropractic care, stress management, nutrition, modifying the posture, altering medications. It was interesting to find that most often the main source of TMJ pain wasn't the bite at all. Many or most time it was the other environmental factors that was causing the pain. It was an increased amount of stress, which included stressors such as a lack of exercise, too much diet soda, poor posture in the workplace, financial stress, chemical imbalance in the body, and more. Because there isn't a TMJ specialty degree recognized by the American Dental Association or the American Medical Association, several educational TMJ clinics with different theories and philosophies have emerged over the years, each having their own philosophy on how to correct a bite and how to treat TMJ pain. So through the years, I've become more and more conservative in my approach in treating TMJ pain, as I've helped many patients through the process. So keep watching this video, because in the next 7 minutes, many of you will find the solution to your TMJ pains. Here are a couple secrets that I've found. Number 1, about 80 to 90% of us have off bites, but 80 to 90% of people do not have TMJ. So an off bite does not necessarily cause TMJ because God made our bodies so adaptable. One person's pain can come from a bad bite and the other from other types of stressors. For example, as I evaluated Rita and found that her bad bite was clearly the problem, I saw that the muscle engrams were apparent as I adjusted her splint. Muscle engrams are avoidance muscle patterns, as the muscles direct the jaw to avoid interferences on the teeth and the soft tissues. Rita's engrams were being erased right before my eyes as her jaw relaxed to a more favorable bite position, right there in one appointment in the dental chair as I adjusted her splint. That one was an easier one to diagnose. But another person's pain can come from other stressors, such as family stress, daily responsibilities, poor posture. Certain foods can cause headaches and jaw pain. For example, I was doing splint therapy on Rebecca, and Rebecca's pain was not going away, even after she had a perfect bite while wearing a perfectly well-adjusted TMJ splint. That was a sign that we had to uncover and discover the other stressors contributing to her TMJ pain. Stress most often causes clenching and grinding, and that clenching and grinding can happen during the day or the night. Even with a well-adjusted TMJ splint, the tension can still be present, causing pain. Secret number 2. We should not correct bites to treat TMJ on every TMJ sufferer. There are many other stress factors to evaluate that are causing the TMJ pains. Through the years, I've discovered that I have seen taking the conservative approach is most often the best treatment and more appropriate. I believe that most TMJ pain is not caused by a bad bite, but from the other environmental or biological factors. So the key to TMJ is to identify the source of the pain from the many different possible forms of stress. It could be mental stressors, such as job difficulties. It could be financial difficulties. It could be stress in the relationships. Or it could be physical, such as poor posture in the workplace, as many of us work in the same position every day. And your body needs to be stretched out, and you need to do physical exercises to counter the tension built up in the muscles from working in the same position every day, over and over. So some just need to start working out aerobically. Some need to do TMJ exercises. Even the best custom TMJ splints may not work if the clenching and tension continues due to those other stressors. Often trauma from car accidents cause pain in the TMJ, but it's referred from the spine in most all cases. So, in that situation, would a patient be better off seeing a chiropractor or a dentist, or a chiropractor or a physical therapist? Everyone's situation is so different. I remember since the first year after dental school, I thought that there could be and should be an over-the-counter night guard available in retail stores and at the pharmacies at a much lower price than what it cost in the dental office. For about 15 more years or so, and believing there should be an affordable over-the-counter night guard that works, that anyone could afford and have easy access to, I had a passion to design a night guard to help those who suffer from such a difficult to treat condition. So in April of 2009, the thought just came to my mind to go into my own dental lab, in my own dental office, and make a night guard out of dental stone. Who'd have thought of that, to make a night guard out of stone? But that's what I knew, so that's what I did. After about 20 physical prototypes, several being made out of dental stone in my own dental lab, more than 36 digital designs, and 1 year later, I finally produced the first functional version SmartGuard night guard and have been making improvements ever since. Now, after 3 years of designing, I believe that the latest generation SmartGuards are the best over-the-counter night guards in the world, and you can mold it yourself right in your own home. Now, as I'm in my 3rd year of making the SmartGuards available, thousands of people have been able to wear them and have benefited and experienced, in some instances, of instant pain relief. Listen to what Stephen said after wearing the SmartGuard after just a few hours. Quote, "I realized that it was as if a switch had been flipped after nearly 6 years of suffering. I could suddenly hear better, see better, and even think more clearly. Apparently, I was in much more pain than I had realized, and all the while it had been interfering with my cognition as well as my ability to function properly." End of quote. I'm passionate about continuing the research to develop and improve the subtle aspects of the SmartGuard. I want to increase the effectiveness and the comfort to work better for more people, better than any other night guard ever designed or created, and that's my promise. So stay tuned for the next video, and I'll go over more common TMJ problems and their solutions. I'll also discuss why some TMJ treatments fail. To help you find the solution to your pain relief, go down below and download the PDF attachment. That should help you get started to better understand the causes of your personal TMJ symptoms. Leave your questions and comments for me down below, and then in a couple of days, I'll go over the solutions for your TMJ pains in the next video. Give me as much information as you can. The more, the better. Such as what time of day you have the pain, what time you don't, what triggers your pain. Give me a good idea of what you've been going through. So leave your comment below and let me know what your questions are regarding your own personal TMJ problems. And I'll try to answer as many questions as I can in the next video. See you then.